Hi everybody, I'm Arkadi Prokopov, and today I'm speaking with Stefan Schmid, who is in Germany, and he was with me in Mallorca in 2010 with Lyme borreliosis. Please, dear Stefan, can you, first of all, a couple of words about yourself? What are you doing? What is your profession?
I'm since more than 30 years, I'm a dentist in Germany, practicing in Germany in a private clinic. And for 33 years, I'm a dentist over there and in private clinics since 30 years. And in 2008, 2009, it was first misdiagnosed, catched me Lyme disease.
Oh, yeah.
And I got very, very sick.
Mm-hmm.
I got so sick that I thought about to sell my practice. I had a lot of pain especially in muscles and joints, mainly in the legs. And I was first treated with doxycycline, an antibiotic, and this increased my neuroborreliosis symptoms. I felt depressed. I had a hard time to stay focused. And what was pretty remarkable, I lost orientation when I drove to a neighbor city.
Oh, good.
I didn't know the way back. So I had to switch on the navigation system. Normally, you have the way, you know it by heart, and you can drive it, but I was totally lost, and without navigation system I wouldn't find home. Pretty nervous. So while I was not in good shape, I could some of this time I could work half time, but I was sweating and I have to change my shirt 2, 3, 4 times a day. And movement by itself, even walking, was very painful.
Yeah, so this is really very serious case of borreliosis, yeah. But you did initial treatment only with doxycycline and the other antibiotics later?
The other antibiotics, then I start reading and start say when that's the mainstream medicine, that's the only thing they can offer. I read that minocycline was much higher available by the blood-brain barrier. So doxycycline was nearly not bioavailable. And minocycline was much more available also in the brain. And then I switched to minocycline, and 3-4 days later, all these neurologic symptoms, they diminished and went away totally.
So minocycline helped greatly. It was great. But why did you stop then minocycline, or what?
The minocycline
was again?
Take care of problems, and it just took care about the problem in the brain.
Yeah.
But there was nearly no effect of the
no effect on joints, muscles?
No effect on the joints, and no effect on the joints and muscle pains, tendon pains. So I looked for another alternatives, and we did a lot of blood testing, and with all these reference labs, Pettenkofer labs, and labs all over Germany, and spent a few thousand euro alone in lab testing, which was not very consistent in the results. And then I went to different clinics in the borreliosis clinics, and they offered to implant me a pod, like when you get chemotherapy. You get at least 6-month high dose of antibiotics. Rifampicin or something like this. I forgot. The mainstream antibiotic from over there. And then I thought I was totally against it, and I said this will ruin my cells and my immune system totally. And looked for different ways. I read a lot of things about it and tried to heal me intellectually as well.
Yes.
Then I tried different things, and I tried something in addition. But thankfully, I met you, and I got on the right track. And my understanding was that the bacteria, the small bacteria, they are anaerobic.
Yeah.
I have to flush the tissue, my body tissue, as well as with oxygen and as well as with an antibiotic.
Yeah.
So, then I found out about your intermittent hypoxia training. And in the first step, we have a sports center for athletes over here, and they train with hypoxia.
Yes.
These go-to-altitude machines. And when I was over there, my pain went away within hours. My explanation was that due to the better vascularization, opening of the blood vessels, the tissue which are before less nourished with oxygen, they get more oxygen. And the immune system can work better over there. Exactly. And this was one big step ahead. And always when I was there with this intermittent hypoxia training, pain went away.
Great. So how long it took that you felt a stable improvement? How many weeks or months?
This wasn't just with this intermittent hypoxia training. This was just a temporary. I tried to figure something out, and I said that these borrelia they can hide in tissue with less oxygen.
Hypoxic niches, yeah. In hypoxic niches, they hide themselves, yeah.
Exactly. And the other thing is they can hide in areas where the antibiotic cannot work.
Exactly,
like in the beginning. Yeah. And they have a mechanism they can roll up, and so their cell membrane is not outside, they turn inside out.
Exactly, intracellular, intracellular forms.
Exactly. Yeah. And so this is also hard to detect by the immune system of the body. And so in my despair, in my pain, I have to find something. And I mentally tried to feel and think like borrelium.
Great idea, yeah.
And they said they also want to live and survive, and what's their strategy, and so on and so on. And so I tried to rule out all these escape mechanisms of that.
Exactly. Yeah.
I did the minocycline. Then I added. I made a whole cocktail from antibiotic. I added metronidazole.
Yeah, metronidazole.
There is in the periodontal department of dentistry, we use metronidazole for some bacteria they are hard to catch. Like spirochetes. Spirochetes are also
spirochetes, exactly, yeah.
And metronidazole works pretty well with them. So I didn't take it for very long because it's pretty demanding for the liver. I think it took 3 or 4 days only. So I started with minocycline. I added metronidazole, and then I used in combination. You advised me a machine which does this a little bit.
Yes.
Hypoxia training.
Yes.
And every other day I went to a hyperbaric chamber.
I see. Hyperbaric oxygenation, yeah?
Yes, exactly. This was a facility in Düsseldorf. They have a whole department about this.
Yeah.
I got oxygen saturation more than 1,000 to 1,500%.
Exactly, yeah.
And this really flushed, I think, or disturbed the borrelia pretty much.
Right.
And I think they left my body and they live with somebody else now. From then on, it got covered. the pain always, all these symptoms, I was physically got more endurance. I could work normally. I still had a little bit pain in the joints, etc., etc. Maybe because I haven't moved for years a lot.
Yes.
Immobilize a patient, maybe he has just by that some problems.
Yes.
And then I started a little bit exercising again, and then it went back. But to be back to normal took 2.5 years.
Yeah. Yeah.
Pretty happy.
Yeah. Yeah. And did you then, after these 2.5 years, did you continue supporting treatment, or you just stopped?
I stopped totally antibiotic.
Yeah.
I stopped this hyperbaric.
Yeah.
From time to time, I use this intermittent hypoxia training.
Yes.
But to be honest, I'm a little bit emotional pain driven. If there is no pain,
yeah, yeah,
it pretty much sits in one part of my office.
Mm-hmm.
But I turned 60 in September, and you're an expert in anti-aging.
Yeah.
I think I should pull out the machine and use it with your advice to get 120 or more with.
Of course.
Healthy brain and healthy
first
body.
of all, you use it for anti-aging, and side effect is suppressing of Borrelia, because we cannot exclude that they completely eliminate it from your body. They can still persist as intracellular forms in hypoxic niches, but they don't cause any trouble, because from time to time you crush them with intermittent hypoxic training.
Yes, that's good. And I feel sometimes when I eat a bad diet, or I don't take care of myself, then I feel it creeping up a little bit again.
Yes.
And this is my instrument to stay with a better lifestyle.
Great. No, so that in general it shows that the main improvement instrument was this introduction of intermittent hypoxic hyperoxic training, because it immediately worked on pathogenetic mechanism of the disease. And you are right. Borrelia are microaerophils. They need oxygen in very little amount. Therefore,
I didn't know that. That's interesting.
Yeah, they are not completely anaerobic. They're microaerophils. They need very small amount of oxygen, so they look for such areas in our body. And these areas, of course, that is ischemic areas with low oxygen partial pressure, and these areas are numerous. Our joints, our muscles and tendons, and even in the brain we have such areas. So, and therefore, just continuing intermittent hypoxic hyperoxic training, we always disturb their biological cycle. They cannot multiply. They are suppressed, they are weakened, and immunity can find them, can look them, and eliminate them step by step. So this is a complex biological approach which allows, I cannot say that is elimination of Borrelia. We don't know if we can eliminate them, but we can continuously suppress their biological cycle. And
let the immune system win. Yeah.
Exactly. And the immune system will find the way to kill them. And simultaneously, the same mechanism, the same method is working for improvement of your mitochondria. So we win twice. We're improving immunity, we suppress bad bugs, and we extend our healthy lifespan.
What was also good in every bad thing, there is also, I feel, something good hidden. I learned a lot through you, especially through you, about anti-aging, mitochondrial, and I wouldn't have learned this without the disease.
Exactly. Disease sometimes it forces you to stay clever, to educate yourself. Absolutely. Great, Stefan. I'm very glad that you so consequently educated yourself and came to really healthy lifestyle. So I hope we will continue and to learn from each other, because
and have the next interview, and then at least in the next 10 years.
Absolutely. Each, I think we should do it. Next, even 10 years and one interview. I turned 70, you turned 60. So very.
I'm very happy and thankful and grateful that I met you, and you are a special person who has a deep understanding of healing and biology, and this is rare in the medical field. On the medical industry.
Thank you. Yeah, I came to this also from my own needs and from my background working in biomedical research with, with divers and cosmonauts.
Yes.
So it works synergistically.
Yes. Then I have to say, спасибо большое.
Пожалуйста. Пожалуйста. Thank you, Stefan. Thank you very much.
Yeah,
okay, then.
Thank you.
Yeah, thank you. Bye.
Hi, everybody.
Bye-bye.
Hi, everybody.
Today I have in my praxis
Max again.
Max again, yeah. We already made a short interview, but now we have even more experience.
Yes, more to tell.
More to tell. So please, Max, shortly first about the beginning, the very beginning, and then how it was developing.
Mm-hmm. Yes, actually, it started everything almost 1 year ago, something like this.
About 1 year ago.
1 year ago. I had quite a huge problems with my knee, with my right knee. It was full of water. I couldn't walk. I couldn't even walk at all. I couldn't go stairs up and down. It was actually hurting quite a lot. Sleeping at night was not possible, only with a pillow underneath the knee. Mm-hmm. So I just bended the knee a little bit. It was possible. In Germany, I actually did so many visits with different kind of doctors.
Orthopedic doctors.
Orthopedic doctors. Also, we did MRT of the knee. On the MRT, actually, you could not see anything which was relevant. And there was actually no solution. Nobody had an idea what's going on actually with the knee. Then somehow I met you. We talked together. And in this case, yes, we just had an open discussion, and you had the idea just to make a very simple borreliosis test. And I said, well, I didn't do it before, why not? Back to Germany. Again, I did it, and yes, for my surprise, the test was positive, highly positive. And so we had at least one direction, what could be in this case.
Yeah, and that was, as far as I remember, that was exactly Borrelia burgdorferi.
Exactly, yeah. 100%.
So classic, classical case.
And I came back to you here, and we discussed again everything, and we discussed about your machine, we discussed about the technology Arkadi is using. And well, I decided to take one of these machines, and I started this therapy quietly strong. At the beginning, very, very slow, but actually frequently, not strong. Frequently is the best word, a better word in this case. So I used it almost every second day, and for just about two months, 2.5 months. And I already felt it before, let's say something around 6 weeks or something, that something was going on. The water in the knee was actually going back. Movement was even more possible, which was not possible. Sleeping was much better. And yes, after these 2 months, I did the test again, the LTT test, and surprisingly, the borreliosis was gone.
Yeah.
And it was a big surprise. And I could also, the progress after these 2 months was even much better. I mean, I fully recovered in my knee. I could even walk stairs, no problem at all. Walking, not at all. Even doing some sports was again possible, and so on. Everything was okay.
Interesting. Specifically, very important that you didn't do any other treatments. No antibiotics.
Not at all. No.
Nothing, no herbal mixtures.
No.
No hyperbaric oxygenation.
No.
Only intermittent hypoxic, hyperoxic
Only
training.
with the machine, exactly.
Good. Okay, and then that was a pause, and you felt something, yeah? When it was maybe 2 months without hypoxic treatment.
Yes, it was something like this after actually I was going on vacation. Of course, I didn't take the machine with me.
Yeah.
And I felt something is again coming back, going on actually, but nothing too bad. So again, I started come back to Germany. I started my breathing. Everything was normal. I didn't pay attention and so on. And what's now interesting in this case, I came back to Mallorca here to make some vacation. And before I came here, already 1 week, I was on some business trips and I couldn't use the machine. Usually I use it every second day. This is what I do it practically. And what really happened, for my surprise, actually, I was thinking the story was over.
Yeah.
So because I haven't heard from this about for half a year or something. Yes. Everything was fine. And it came back. My knee, Arkadi, I was showing it to Arkadi, was going bigger, bigger, and bigger within like 24 hours or something like this. I came back to you again. We discussed what to do, what to make. Arkadi gave me one of his machines here in Mallorca so I could use it. And
in a hotel.
In a hotel, yes, in a hotel. And in this case, yes, I could see again the progress very easy. After 2 days, it was almost gone. So I can really prove or tell when I do not use the machine, something is going on in my knee. When I use it frequently, actually it's kind of controlling it.
Yes.
That's what's happening.
Yet now my comment. First of all, so far as I understand, that was the first of all, of course, that was the primary site of infection, your knee. Probably you have in your body no other hideouts of Borrelia, because they just from the very beginning they found the one and only place where they are domesticated, settled. And this is because our cartilage, our tendons, they are hypoxic from the nature. They have much lower oxygen content, they have much lower blood perfusion, and therefore immunity cannot kill Borrelia, cannot even recognize Borrelia in these hypoxic niches. So they found there's a fortress in your knee. But from the picture of the initiation of disease, it's clear there was a quite significant inflammation and probably a lot of Borrelia there. As soon as you started intermittent hyperoxic training, it immediately suppresses their biological cycle. They cannot proliferate, they cannot multiply that efficiently as they do normally, and therefore their activity reduced. Many of them were killed, hopefully, but still a certain amount is already transformed into intracellular forms and maybe into cysts. And because the volume of the tissues, of hypoxic tissues in the knee is quite large, we can imagine that there are many such still hideouts of bacteria. They are not active, they are dormant. But they are ready to awake. And this can happen even with the smallest provocation, like you came from Germany where we're cold, here is very hot in Mallorca, a little bit of stress, this and that's enough for them to wake out. But because it was very beginning, it's a very beginning, the first stage of inflammation. Only when there's a production of inflammatory fluid, so it is not really inflammation which is developed, it's what's only beginning. And when you used again intermittent hyperoxic training, immediately it suppresses bacterial life cycle, they became inactive, they die out, immunity can recognize them, and water is
just gone.
Eliminated.
It must be, sorry to bother you, it must be also some kind of memory effect, because at the beginning it took me almost 2 months to go this back. In this case, so it took me only 2 days, so it transformed back.
It was early enough to start. We started early enough, and of course when you do hypoxic treatment for a long time, your body has memory, exactly. It reacts much faster. Each next session, each next series of sessions your reaction is much faster. So strategically, we should understand that probably you have still a lot of them in your knee. And to eliminate them completely, you need to cycle this. You need to cycle this. You even maybe to give them a provocation, like it happened here. To come out. And then again, switch on this biological modulatory treatment.
Yes.
This strategy can really cure you in a certain time. I had patients, for instance, who similarly like you, they were with remitting, borreliosis came as attacks because, the life cycle of Borrelia about 2 weeks.
Okay.
They are very special. They multiply in a cycling way, not each day. 2 weeks, then they multiply, then 2 weeks pause again.
Okay.
So to give them this cycling pattern and eliminating them as soon as new generation develops.
Okay.
And then, after a certain time, there will be no more new generations because the intracellular forms will be exhausted and even cysts.
Okay. The interesting part about this, like I said, I did the LTT test, which is probably measuring only the intercellular form, not the cyst form, because the test was no more positive.
Absolutely. You cannot, cyst forms you cannot measure because they are neutral, they are inert.
Okay.
They don't produce antigenic stimulation, immunity doesn't produce immune answer to them, therefore they are invisible for immunity.
Okay.
Therefore you need to provoke them to develop.
Yes.
And then attack them again. It takes, for my experience, it takes up to 2 years, 2.5 years, up to 3 years until you completely eliminate Borrelia from such hideouts with biological methods. Of course, you can also add some medications, definitely. There are some medications against cystic forms and of course against intracellular forms. But this is not the topic of our discussion now.
Yes, of course.
Yeah. So great. So I'm very glad that you are such a biohacker, experimenting with yourself.
Yes, exactly. That's what
trying to find new ways to solve this huge problem like borreliosis. And we can continue.
Sure. So we will continue the interview maybe in half a year or 1 year.
Oh, yes.
I will tell Arkadi actually what's going on and see how the progress will be. But actually now I'm understanding more what the issue is.
Yes.
So and also the idea to let them come out and then to destroy them is also a good way.
This is very important because these relapses, they are not new infection, mostly just awakening of the hidden dormant bacteria. Perfect. Okay, Max, thank you very much.
Arkadi, thank you. So,
bye.
See you. Bye-bye.
Hello, my name is Sylvia and this is my husband Mirko, and Mirko was sick. So, but I don't know how to introduce myself, you see? Sorry.
First of all, you are divers. That's most important.
Okay.
You are both divers. You are profis, scuba diving.
Okay, so that's what's important for you.
Yeah, that's important because it explains a lot in the whole story. The story when Mirko felt better after diving season. Mirko looks great, by the way. He is really very healthy.
He's trying to.
Yeah. Okay.
So, okay, once more.
When Mirko was diagnosed with Lyme borreliosis?
It was about 2015 was the diagnosis.
And after diagnosis, he got conventional treatment, yeah?
Yes, he got conventional treatment was actually few different antibiotics, only with antibiotics, and the last 2 times even 40 days intravenous. But it doesn't, intravenous, yes, but it doesn't work actually.
So he still had all symptoms, pain. Yeah, what was the most symptoms were pain. Yeah, in the joint.
He had a lot of several problems. So he was barely walking, joint pains, tired and unmotivated. He had dizziness, problems with the vision, with the throat, itchy skin, and it was all together. I don't know. Every day something new.
Yes, yes, yeah. This is typical disseminated Lyme.
Yes, so he just told me, and also high blood pressure.
Yes.
It was unbelievable high blood pressure.
Yeah. And then you found in internet my presentation, short presentation about treatment of with hypoxic training, yeah? And you decided to try it for yourself. But interesting, before you say you noticed that in summer when diving season was, Mirko felt actually better, yeah?
Yes. After each diving season, he felt really better, and for a long time, maybe 3 to 4 months, he felt really better. And after that, it was again getting worse. And after that, he again getting the antibiotics, and it was even worse.
Yeah.
But diving keeps him, how to say, alive.
Yes, of course, yeah. Okay, so then you came to me, to Mallorca, and we made about 1 month of introductory treatment, yeah?
Yes.
How, when the improvement began? When improvement began? When we started, I think it was about 5 or 6 sessions, yeah? And he felt better.
He felt a little bit better, yes, but really improvement that we were sure about that it worked. It was about maybe 3 to 4 weeks after we started.
Yes, yeah, great. And then you continued the program at home.
Yeah? Yes. And at home he was also breathing, and maybe after 2 months he was really healthy for us. He felt healthy.
So altogether it took about 2 to 3 months to get to stable improvement. Okay. And after what time he felt completely okay, that he is just healthy?
Yes, after these 2-3 months, he felt already healthy, and after half year we made a first test of the Lyme disease again, and it was already negative, the first test after half year.
Yes, yeah, that's important. That's very important, yeah. That seronegative, no activity of Borrelia.
Yes.
Then, since then, you use hypoxic treatment practically without long interruptions.
Sometimes Mirko just made interruptions for 3-4 months because sometimes he really doesn't have time, but there's no problem. He have any more problems with the Lyme disease or something.
Yeah. So even after interruptions for a month or 2, there is no relapse of Lyme.
No.
But I remember last summer, you told that there were some symptoms, some small symptoms.
Yes, he had once some small symptoms, and that was maybe half year because he didn't breathe, he didn't make the therapy, and then he again started with this breathing, and everything went away again.
Yeah, very good. So during this time, he didn't use any other treatments. So maybe different protocols, some herbal stuff, or no other protocols, only hypoxic, hyperoxic treatment.
Yes.
Very good. Okay, and what does he do now to maintain his health?
So now, actually, he sometimes went to the sauna, or and he takes some of the supplements like vitamins or minerals, just to improve the health, but nothing special.
Nothing special. Great, great. So it's one more proof that this treatment is a pathogenetic treatment against Lyme. And I'm now trying to make it more available, more affordable for people. And Mirko's example is one of the best because he went through the very heavy antibiotic treatment and then this complete recovery only with intermittent hypoxic treatment. I'm very glad that everything is so good, and I hope you will use this method again. So don't stop using it, because you know when you use it, you stay younger.
Yes.
Your aging process is slowing down. Perfect, perfect. Okay, thank you very much.
Arkadi, thank you very much.
Yeah.
So Mirko asked if you would like to see his breathing protocol today. He just
yes, if you can send me last pictures, screenshots, it would be interesting just to see how far is he, what is the hypoxic load he can tolerate. It would be very useful. Okay, my friends, thank you very much.